welcome. You're watching Medically Speaking. I'm Meenakshi Upreti. Joining me is Dr. Sanjay Vadhwa. He's associated with the Medical Rehabilitation Department of AIIMS. It's an honor to have you, sir, on NewsX. The issue which you wanted to highlight, very rarely spoken about, the disabled or the specially abled, as I should call them. COVID pandemic has been harsh on all of us, and especially on those who are specially abled. Talk us through their hardships and how they were ignored during the period of the pandemic, sir.
I think this is a good question to start the program. The COVID pandemic has been very challenging for all of us. Throughout the world, it was very sudden, it was very severe and a global phenomenon. And we were experiencing it for the first time. It was a greatly disruptive phenomenon. It disturbed all aspects of life, necessitating lockdown, necessitating so many other issues also, such as maintaining distance, maintaining hand and face hygiene, and using the mask. And if we look at persons with disabilities and their day-to-day life, many of the persons with disabilities need the assistance of a caregiver to hold their hand, to help them in moving about from one place to another, to get them out of the bed and to take them to the toilet, etc. So when you are required to maintain distance and not touch others, how do you ensure that when the scenario is involving a person with disability? So this was a very big challenge to them. Second thing, there are many assistive products, aids and appliances which are used by persons with disabilities, ranging from a simple walking stick to an advanced type of wheelchair. So people with disabilities initially did not know how to sanitize these products so that these products do not become a carrier of coronavirus and infect them or their caregivers or their family members. This was another issue. And disability is of several types. Now, people with hearing-related disabilities, they often depend upon the lip reading to understand what the other person is saying.
Yes.
When the face of the other person is covered with a mask, which is not transparent, they find it very difficult to understand what the other person is trying to say. So these were some of the very obvious challenges. And then access to healthcare was also disrupted because of nationwide lockdown. Then availability of medicines also got disrupted. Availability of resources for repairing their mobility-related products or assisted devices because of severe nationwide lockdown, etc. So therapy were also affected because hospitals were shut down. But we tried to manage through the online mode of communication like e-medicine, e-rehabilitation and other things. So these were several challenges which were in front of the persons with disabilities, and they gathered their strength and we were able to guide them and motivate them and keep them going on. But it required a lot of courage and a reorganization of several services and a new way of looking at the things, a new way of organizing services. So it was a very big challenge, but I'm glad that we have significantly overcome those challenges and now we are on the way back to normal.
Right. And, sir, we've talked about how the pandemic affected those who are specially able, but talking about, the disabled in a broad-based way, is there a more severe or a different health-related issue which they suffer from, which we should also be apprised of?
There are many issues. And one more thing I want to add in the answer to the previous question, that vaccination drive started all over the country. Initially, it was difficult to reach people with disabilities to immunize them, to administer the doses of COVID-related vaccine. And for them also, it was difficult to reach the vaccination centers. So a lot of efforts were made so that the vaccination can reach their doorsteps, so that their hardship is not further compounded. And I'm very glad to say that many people with disabilities have benefited and they have received the doses of protection against COVID by way of the vaccines. Now coming to your next question, there are several health-related challenges. Now, people with disabilities also suffer from the same diseases from which people without disabilities suffer. But there are certain conditions which are more challenging for them. For example, a person who sustains injury to the spinal cord and loses the ability to move about independently and is therefore forced to use a wheelchair as a source of mobility. The hardship by that person is much more as far as the experience is concerned. So disability is an experience and no two individuals are alike in terms of the disease condition, in terms of the experience, in terms of the resources and rehabilitation services. persons with disabilities require medical rehabilitation as the first and foremost concern. And unfortunately, the medical rehabilitation services in a country as large as India and as diverse as India are still require a lot of improvement in terms of reach and quality. The number of trained personnel who are going to provide rehabilitation services is also small in number. The training institutions are also small. Although I am glad to say that since independence, a lot of progress has taken place. And the progress has been very rapid. Since the 1981, when the International Year for Persons with Disabilities was declared by the United Nations, which brought into focus the needs for programs for them. But a lot more needs to be done.
You say a lot more needs to be done. Let's talk about this in greater details. Part one, what has the government done? If you could answer that. And then we will take on the type of healthcare facilities which are available and the lacunas which you see in the system, sir. So take us through what you think the government has done and any suggestion which you have, sir.
I must first of all compliment the government of India for having done a lot of good work and in a relatively short span of time. Because the challenge was enormous and the government services sources are also limited, no matter how advanced you are. But I'm glad that the government of India, through the Ministry of Health and Family Welfare, put in a mechanism so that system could be put in place, vaccination supply could be ensured, and India is one of the very few proud countries which could manufacture vaccine in its own country instead of importing from abroad. So there are many positives than deficiencies. However, we must understand that the challenge was enormous and the information which was being spread and shared by the Ministry of Health, it was generally in a language which was written word or through the audio visual. And imagine a situation when the person with visual disability is there. The information was not easily available or widely available in the Braille format.
Yeah.
And people with hearing disability also had difficulty in accessing the relevant information. But once the issue was realized, steps were put into place to resolve these issues also, and a lot of progress has been made. So there are many success stories, and people with disabilities, despite having suffered from coronavirus infection, they also came out successfully as a result of the treatment and rehabilitation.
Right. And, so you spoke of the efforts which have been undertaken by the government of India, and you also spoke of the lacunas in the system. Why don't we talk about that? Healthcare, is it easily available to those with disabilities or not as of now? What is the gap which needs to be met?
The situation is not ideal, although there have been improvements in the last 10, 20 years. Still, the healthcare is not easily accessible to all persons with disabilities. This is true about even persons without disabilities also. Although there is a large network of primary healthcare centers, secondary healthcare centers, and tertiary hospitals and all. But no matter how many centers you open, transportation is an issue. And this is one of the important barriers for people with mobility disabilities. They cannot reach the hospitals so easily and so often as required. Many a times, there are no caretakers to take them to the hospitals. And every time the hospital services cannot enter or reach the doorsteps of the individuals. Although the more peripherally the services are arranged and placed, they are closer to the residence of the person with disability. But then there is an issue that how good quality care can be provided near the doorstep. Because the closer you are to the person with disability, perhaps there is some compromise in the quality of care. The advanced care which can be provided in larger setups will naturally be lacking in the remote areas or primary care setups. But what is important to understand, besides focusing on the treatment and rehabilitation, enough efforts have perhaps not been put in place for prevention of disabling conditions. According to World Health Organizations, almost 60 to 65% of disability is preventable. And if we look at the causes of disabilities, these are certain health conditions which are infections.
Yes, sir. And could you elaborate on these health conditions? Because that was going to be the last part of the interview. I was saving it for the last. The health condition which cause these disabilities, sir.
If we look at the causes of disabilities, they can be classified into various ways. One of the way to classify them is whether they are present since birth or they occur later on in life. And this is hereditary or acquired. Acquired is something which happens later on in life. The other way of classifying the causes leading to disabilities is according to the condition or the causation, whether these are communicable diseases, for example, poliomyelitis caused by virus. Fortunately, new cases of poliomyelitis have been stopped completely. But what about providing healthcare and rehabilitation to people who were affected earlier and they are still having weakness and difficulties in mobility? Another important thing is that after 25 to 30 years of onset of polio, some people develop certain conditions which are known as post-polio syndrome. That means muscles which were earlier not weak, they also start showing signs of weakness. And I'm sorry to say that there is less awareness about post-polio syndrome among the physicians in general and persons with polio themselves also. So this is an important thing, and it is an important health condition. So it gets diagnosed very late, and therefore the remedy is offered very late. The other are communicable diseases such as tuberculosis, leprosy. These are also leading causes of disabilities. Then there is a large group of people with disabilities who are because of non-communicable diseases. And unfortunately, the number of such people is increasing very rapidly. And the leading non-communicable diseases include diabetes mellitus, cardiovascular diseases, chronic respiratory diseases, certain neurological disorders such as stroke. These are non-communicable diseases which are to some extent related to the lifestyle. And important risk factors among these are cigarette smoking, lack of physical activity, hypertension, hypercholesterolemia, blood sugar being very high, stress. These are also disability causing conditions. Then injuries are on the rise, whether it is as a result of road traffic accidents, whether it is a result of industrial accidents or injuries at the agricultural fields, or fall from height or construction sites. These are adding to the pool of disability. Then the age-related disability is a very significant group. As people are living longer and longer, age itself is leading to diminished physical ability. And more people are now living much longer, and they are having visual disability due to cataract. They are having certain cancers which have a direct link to the longevity of life. They have musculoskeletal degenerative disorders involving their joints and muscles and nerves. They have degenerative disorders of the brain and nervous system. So all this is leading to expansion of the overall pool of disability. And the causes are changing. Some of the causes which were very prevalent earlier, they have been overcome to a large extent. And namely, that is acute poliomyelitis and new cases with leprosy. But other conditions have taken their place.
So you have, of course, in detail told us the causes of disability other than, of course, genetic ones. My very last question, as we are reaching the fag end of the debate, we're left with a minute or so to close the discussion. Last question, any suggestion, any word you'd like to say as you sign off today, sir?
I want persons with disabilities to focus on improving their health condition themselves also. Instead of being a passive recipient, they should be proactive and try to focus more so that they, by their own efforts, also improve their health condition. And they should never ignore their annual health checkups, because many of the disabling conditions can, if they are picked up early, they have a less severe or devastating effect on the individual. So if they know their blood pressure status, if they know their blood sugar status, if they themselves were smoking and they quit smoking, they can improve their health by these measures. And they should prevent injuries also, because injuries are important contributor to the disability.
Point
These are
taken,
some of my suggestions.
Yes, point taken. I think it's a very, very informative session, and we focused on a section which is very rarely spoken about. And I hope that someone, from the specially able section has been able to benefit from all the suggestions, all the tips which you had to give, sir. Thank you for joining us on NewsX.
My pleasure. Thank you.
For more such videos, subscribe to the NewsX YouTube channel, hit the bell icon.